Hello, I'm Dr. Sandhya Rani, Senior Consultant Obstetrics and Gynecology Department, Aster Women and Children Hospital, Whitefield, Bangalore. Today I'm going to talk about something called VBAC, Vaginal Birth After Caesarean. It is also called TOLAC or Trial of Labor After a Caesarean Delivery. So what is this about? So women who had previously undergone a cesarean for any reason and who wish to try for normal delivery in the next pregnancy can opt for this particular procedure called VBAC trial. So who are the women who can opt for it? If your previous cesarean was done more than 3 years ago, if it was for a non-reoccurring indication, that is, if it was done because of the baby's heartbeat going too low, or if because the cervix did not open up on time, or if it was because the baby was too big then. But now you have all the conditions to satisfy for a normal delivery, like the baby is of average size, you have gone into labor, there are no medical complications as such. So these are the instances where you can try for a normal delivery. So when you should not go for a trial of normal delivery, if at all you had more than one cesarean section, then better not to attempt a trial for a normal delivery because the strength of the scar will be less. If at all the previous cesarean was done in a vertical manner, usually the cut on the uterus is a transverse one, but if for some reason the previous doctor had made a vertical cut, it is better not to try for a normal delivery next time. If at all there was any complication like the cesarean scar or the incision which was made on the uterus had extended a little more than usual, or if your cesarean was done when you are fully open, that is called a second stage cesarean section, again better not to try for a normal delivery next time. If at all there are any growths in the uterus like fibroids, or if the placenta is on the lower part of the uterus where it may not allow the baby to come down for a normal delivery, better not to try. But if at all you fulfill the criteria, ask your doctor about a VBAC trial. So what would the doctor do? So in a VBAC trial, there should be a facility for 24 hours anesthetist and 24 hours obstetrician availability. Once you come down with labor, or if we have induced pains, once the contractions start, you will be continuously monitored for any chances of scar rupture or dehiscence, that is opening up of the previous cesarean scar. So how do we monitor? There will be particular gadgets connected to you. One where the heart rate is continuously monitored. If at all the previous cesarean scar is trying to open up, we get clues in the form of fast mother's heartbeat going up too fast, or the blood pressure dropping, or when we put a urine pipe, the blood stained urine comes out through the pipe. Sometimes the baby can also give us clues like baby's heartbeat going too high or too low. So all these will be monitored continuously in a setup where we have a chance of doing a cesarean within 10 minutes from the identification of the problem. So what is the success rate of a VBAC trial? About 60 to 70% success rate will be there. In about 30 to 40%, we may still have to go for an emergency cesarean. So, in hospitals, especially in our hospital, Aster Women and Children Whitefield branch, we do try for VBAC trials because we have the anesthetists, we have resident doctors and obstetricians round the clock. So in such a facility, we do have the confidence that we can give a trial, and if there is a complication, we can convert it into an immediate cesarean within 7 to 10 minutes of the diagnosis. So what are the things that can go wrong in a VBAC trial? The scar opening up, or the baby having so much of distress that baby may require some oxygen after it is born. Sometimes if the scar opens up completely, the cut may extend into the urinary bladder and cause some injury, but these can all be handled by timely intervention. We are confident that we can give you a good trial. Success rate is 60%, but a good trial can definitely be given in our setup. Hope this helps you understand what a VBAC trial is, and if you are the right candidate and you wish to try for a normal delivery, do reach out to us. Thank you.